All right, I think we can get started and have people join in as they come. So hi, everyone, and welcome back to the Magi's e-learning webinar series. I know it was a bit of a break between the last time we did this and now, but we're really excited to have you back. So thank you for registering. Today, we're going to be talking about how you can add on new functionality to your existing applications that may already be in use. So without further ado, let's get into the introductions. Erin, I'm guessing a lot of you know her already. She's the Director of Customer Success at Dimagi. She handles onboardings and she makes customers like you feel comfortable using CommCare and also maintains relationships with our enterprise customers. And that's me on the right. I am Avni. I'm the Customer Success Manager. I'll be facilitating this discussion and also manning your questions and answers through the session. Okay, so to quickly run you through the agenda for today, the first thing we want to cover is what are some things you should be asking yourself when you are building on to an existing application while adding new functions. How do these new things that you are adding impact your existing case structure? Or if you're trying to build case management from scratch, how does that impact your entire application? What are some design considerations you need to keep in mind? What are some changes you'll make on HQ? And how will that lead to a good experience for your mobile users? And finally, what are some implications on the data side? Will any change that you make have an impact on the exports that you're creating, be it form exports or case exports? And we have some time slotted in towards the end for Q&A. Please do submit your questions in the Q&A box. I'll be manning that. There will be a recording of this webinar, which will be sent to you. And we'll try to cover as many questions as we can, either through the session or towards the end. But in case we don't get to any questions, someone from the team will reach out to you. All right, over to you, Erin.
Thanks so much, Avni, and thanks everyone for joining us today. We did want to start a little bit and just talk about why are we covering this topic right now. Obviously, during the pandemic, we have been trying to do more frequent webinars. We know that a lot of people, of course, are maybe pausing some project activities or having to take a step back and look more holistically at their projects. And specifically with this topic, we know that many on-the-ground projects are adding in or adjusting their workflows because of COVID-19, whether it's because COVID has affected the way that your project can run itself, or if you'd like to add in new services to projects. Maybe there's some additional COVID relief sort of things that you're doing, or perhaps you're even adding in some COVID-19 screening forms. And of course, one of the things that's so great about CommCare is that it is easy to add in new services and add in new forms and modules, even new case types to your application relatively easily using the CommCare platform and releasing that pretty widely to all of your mobile workers. But app changes do have very important user interface, case structure, and data implications. And a lot of times we see people in a rush to add new parts of their application, and they're not always walking through that whole design, building, rollout sort of process that we would like them to, in order to make sure that they understand how the new part of their application is going to function within the ecosystem that they've already created. So I want to take us now into some considerations for adding new functionality. These are kind of the questions that you should be asking yourself, the things you should be thinking about as you embark upon adding a new facet to your application. So the first question is, what is my purpose? So why are we adding this? Are we adding an entirely new service? Maybe before we were just doing food distribution, now we want to distribute medical supplies as well. Are we adjusting an existing service? So, before maybe we were doing food distribution only of lentils and rice, maybe we're adding some new foods to it. So that's adjusting an existing service. Or are we adding an entirely new item to track? So maybe we had, a maternal and child health application, and now we're looking to add something for the fathers of these children as well. And so you want to kind of figure out where you land in that spectrum to really be purposeful about what you're adding and why you're adding it. The next question to ask is, how does this fit into my existing workflow? So first of all, when will the data be collected? Will it be collected within a visit that already happens? Maybe you do monthly household visits and you're just going to ask these new questions during that existing visit. Maybe you actually are going to need to do specific outreach, so new visits, or more phone calls, more SMSs to actually get the answers to these questions. Who is going to collect the data? Is it going to be your existing users? Will you need to hire some new users to do it? Is it practical for your existing users to take on this additional functionality? And will that have any sort of impact on the amount of work that they're meant to do? If you have a household visit form and right now your mobile workers are meant to fill that out once a month and go to every household once a month, now let's say that you add a food disbursement system, and so they also, in addition to filling out the monthly visit form, have to fill out this food disbursement form. If that form takes as long as the monthly visit form, you've now doubled the length that every household visit is going to take. So you should think about, maybe I need to add some more community health workers. Maybe I need to adjust the targets for how many home visits my workers can do. Those are the sorts of things that you want to think about from a workflow perspective. Then you also want to think about, who are you speaking with or tracking? So again, if I'm doing a household visit and I always speak to the head of household and I'm adding a COVID screening form, it's fine. I can still speak to the head of household. If, like I said, I have a maternal and child health app and now I want to start talking to the fathers, maybe about things like gender-based violence topics, I now am going to need to speak with an entirely different person. So you need to think about how you would plan your visits to make sure both the mother, child, and the father could also be there. Also think about how you're going to collect the data. Are you going to be using the mobile application? Will you maybe be using an SMS survey? And if you're using the mobile application, are you going in person? Are you going to need to do a remote visit where you're actually calling and then recording the information that way? So that too will affect how this fits into your existing workflow. Next, you want to think about, how does this new data I'm collecting fit with and connect with other data that's in the system already? So are we just collecting additional information about a case that already exists? In the case of the household monthly visit, if I'm collecting some information about if anyone in the household has COVID symptoms, that's fine. That's just going to be more information about that household case. Am I creating a new case that's related to other cases? So again, in the mother and child example, the maternal child health example, if I want to start tracking fathers, that's an entirely separate case type, but we do want it to be connected to the mother and the child. So how are we going to establish that connection to make sure that those three cases all indicate that they are connected to each other? Or then lastly, is this just completely unrelated to cases? Occasionally we'll see projects who might be implementing a large project with a very focused group of people, and then all of a sudden they need to do a wide population survey. And so they just tack on a survey at the end, and they can pretty much ask it to anyone, and they don't really care if you're already part of their program or not. They just need to get this wide population survey. So in that case, that new information would be totally unrelated to any cases that already exist. So this is going to be really important for figuring out not only where can this form or where can these questions go within the application, but also what is this going to do to my case structure and how is that going to affect the exports that I have. And then lastly, and this is something that I think does not get nearly as much focus as it should. I think we focus a lot on actually building out the functionality in CommCare, but how are you going to communicate about this change and roll out the new functionality? You definitely need to announce this change to your users. Hopefully it's actually based off of feedback that they've given you. So, if you're going to add a COVID screening form in and you're going to do that in the next month, it doesn't hurt to start telling them, on August 1st, we will now have a COVID screening form. So plan for how you're going to do that communication. You're also going to have to manage a remote app update for all of your users, or an update where they all come into the main office. Of course, remote application updates is one of the things that CommCare supports, and we would definitely encourage you to take advantage of the fact that everyone doesn't have to come to the main office to update their application. But it is very important, if you're rolling out new changes, that on the day you want that data collection to start, everyone updates their application on the same day, so we're all working off of the same new version. And that process, I think, takes people much, much longer than expected. And you, as the administrator, need to go into CommCare. You need to look at that app status report. You need to make sure everyone's on the right version. And anyone who's on the old version, you need to follow up with immediately to make sure they're getting on the correct version. And then lastly, depending on the scope of the change, you need to decide what sort of end user training is going to be necessary. If you're adding in a very simple COVID screening form, maybe a self-check form for the users, and it's only 2 or 3 questions, that's probably something that you could just, mention in a WhatsApp message or in, kind of your initial communication. If it's a fairly simple form that's very self-explanatory. If you're adding an entire new survey or an entire new functionality that people are not familiar with, you may need to do some additional end user training. So either a refresher training or a new end user training, but think about the way that you are going to instruct your users how to use this new part of the application. Then we're going to talk about kind of the case management considerations. It's really important to think about how this new data relate to data that is already in the application. So like I was talking about before, you might be collecting data about an existing case. So additional data for a case type that's already included in your application. That's probably the easiest. That's just a matter of maybe adding some new case properties and maybe having a new form export. You might add a new entity that is related to a certain case in your application. And so then you're going to need to think about adding a parent-child sort of relationship. And so you can easily do that by just changing, adding on, augmenting the existing case structure that you have. And then lastly, like I said, you could have a case or a new data that is just completely unrelated to any case that you have. And so this would be those sort of wide-reaching surveys, things that we don't actually need to collect out and look at longitudinally, something that's a one-off survey that we really don't care who it's about. And so that will be kind of data that you collect in the app, but isn't really linked to anything else that you're collecting. Next, let's talk about some of the user interface considerations. And in particular, I'm talking about the UI for the mobile workers here. So there are a few different ways that you can add these new questions, this new functionality in. The first would be to add to an existing form. So for example, if I have a monthly household visit form and I want to add some COVID screening questions, I could just add 3 or 4 questions at the end of that existing form. And that will really easily, it won't require my users to go in and enter a new form. It will just require them to go through the same form that they're used to filling out all the time. It's just that they're going to have a few more questions. So that, from a mobile worker's perspective, is going to be very similar to the workflow they're used to. They just will need to know to expect that there will be new questions in a form that they've already been using. Next, you could decide to create an entirely new form. So this would be, maybe you have a baseline survey and now you're going to add a midline survey. This, obviously, you'll need to be very explicit with the users about the fact that they need to fill out a new form. Similarly, like when we were talking about adding a COVID screening form, if you don't add those screening questions into an existing form, you'll just need to let your mobile workers know, okay, normally when you do a household form visit, you fill out form A, B, and C. Now you need to fill out form A, B, C, and D. So just making sure that they're aware a visit is not complete until they've also filled out this new form. And lastly, you could also create a new module, either if you are adding something that you feel like is distinctly different from your workflow. So for example, I have a partner I was working with yesterday who has a project, and right now they're working on skin cancer prevention, but they also work on vision. And so if they added in vision, even though the case type would be the same, it's a distinct enough different sort of topic that they would put it in a new module. Of course, if you're going to have any sort of new case type, that definitely means you need to be in a new module because you need to set your case type at the module level. Then in terms of data implications, there are a lot of different ones depending on if you're looking at form exports or case exports, and depending on how you've decided to add this new functionality in, if it's within an existing form, a new form, or an entirely new module. So for your form exports, if you are adding in fields to an existing form, you obviously will start having in those form exports the option to add in those new form properties. So, if before I had 10 questions, now I've added 4 COVID screening questions. When I go in to configure my form exports, I obviously will see those 4 new questions. And of course, if I add those to my form exports, we obviously know that anyone who we collected data for previously before we added those questions will have blanks for all of those. That's not concerning for us, but it's something that we should know, because if someone came and audited our data or was looking at our data, we would need to explain to them why they're seeing blanks in the data. And it's because we would have added this new functionality. Then secondly, with form exports, if you're adding an entire new form, a separate new form, you obviously will need to set up a new form export for that if you want to look at the form data. And so in doing that, you'll just want to understand how to connect that data with other indicators. And if you are going to rely heavily on form exports, of course, oftentimes, especially if it's a follow-up form, and people are using form exports, they will find it useful to add hidden values into that form that bring in data that's important, like the, maybe the case's name or date of birth or other information about the case that they feel is important to have with that same data set. Then moving over to case exports, either way, whether you are adding questions to an existing form or if you're adding a new form, you will need to decide which of these new fields need to be added as case properties. Certainly once you add them as case properties, they'll be available in all of your case exports, and you'll be able to amalgamate properties from across the application. Do know, though, that obviously these case properties will be blank for all cases until you start filling out the new questions. So if I have COVID screening questions that I am putting in a monthly household form, those properties will remain blank until the next time that someone does a monthly household visit with that household. So again, a lot of times when people log in and they download their data and they see blanks, they get very, very freaked out. There are good reasons why things might be blank. So that's just something to keep in mind and know. And so you know not to worry when you see those blanks. And lastly, with case exports, if you are adding a new case type, of course, that's going to require setting up new case exports. And then you're going to want to understand how this case interacts with the other cases around. So if I have created a new child case in my application, say before I was just tracking farmers and now I want to track their land plots as well, I need to understand that that land plot case export is going to only be that land plot data. And if I want anything saved down from the farmer data, I'm going to need to do that separately in, save those case properties separately. And I need to figure out how I'm going to link my land plot data to my farmer data using that indices.farmer field and making sure that I know how to merge that data. So with that, I know a lot of this can seem very hypothetical, very theoretical until you actually do it. So we do have some examples that we prepared and I'd like to go through now to kind of contextualize what we're talking about. So the first example we have is adding in a midline survey. So this is something we see a lot where someone says, I need to deploy something in the next 6 weeks. And they come to us with this huge application and we say, there's no way that you can deploy and build this in 6 weeks, but you could probably build your registration form to do the initial enrollment. And a lot of times, we see donor pressure or government pressure to roll things out very quickly. We know that hurried rollouts do not lead to good things. And so this is definitely something we've suggested to people who have these really aggressive timelines, but don't necessarily have the time to build out their whole app for the very first day they're launching. Of course, one caveat with that is that you do need to think through the entire application design, even if you're only going to build out your registration or enrollment form. You need to make sure that you're setting yourself up with a sustainable case structure and that you've got room to scale in the way that you want. So like I said, the example here is that your project needed to roll out very quickly. You built the baseline survey, which is also serving as the registration form, and you deployed that application to begin your data collection. Now the baseline survey is complete and the midline survey is going to take place in 6 months. So we need to build out this midline survey within the application. So if I come here into CommCare, what I'm going to do here is I have a youth survey that right now just has that baseline. And what I'm trying to do is just add my midline. So what I'm going to do, and what I would recommend you guys do, is instead of recreating the midline from scratch, I'm just going to copy this form over. So I've come into my form settings, and now if I go to actions, you'll see that I can copy this form, and it's just asking me the module that I want to copy it into. So I'm going to copy it into that same module. Again, this is a midline survey, so we're collecting new data, new pieces of data about an existing case type, about this youth case type. So we're not adding a new case type, and we're not, just adding a survey that isn't related to anything. We're collecting new data about the youth that we already have. And like I said, these questions we do expect to largely be the same, so we don't want to just create it from scratch. We can copy over and adjust the form as we need. So I'm going to rename this to say midline survey. And then if you remember, I said that this form serves, the baseline survey form served as the registration form as well as the survey. And so you'll see we don't need to ask them at midline what their name is, right? And we don't need to ask them about consent because they've already consented into our program. We don't need to ask them their date of birth. And then really where the midline questions begin are here. So I'm going to delete all of these things that were clearly registration fields. So I've just selected them all. I was pressing down on this and then I pressed shift on my keyboard and then clicked on it. That's how I was able to select multiple ones at a time. You'll see that occasionally when you do delete questions like that, you'll get some errors here. And so right here, you can see we have some display conditions that we're now going to need to remove because they're no longer relevant. So when you do some question deletions like this, just make sure that you go through and you delete out your display conditions or you address these errors. So I'm just going through and I'm removing these. You could also replace them, certainly do whatever. It's not that you always just should delete them. You need to think about how this is going to affect the app. So these are the midline survey questions that I'm interested in. And you can see how quick that was. If you really do have a baseline and a midline that are going to be pretty much the same, you can really save yourself a lot of time by doing that form copying. Now, the last thing I want to look at for my baseline, I had saved many case properties here, and we can click here and see all the case props. I saved every question as a case property. For this midline, since we did copy this form over, the case management should have come along with it. It's going to have some errors here, again, because I deleted some questions. So, it's not able to see this consent, date of birth, school completion. So just delete out those case properties. And that looks pretty good. The last thing I want to check is we have these questions at the end. about workforce readiness, employability, and job importance. I just want to make sure that those are saved in our midline form as well. Yep, those came through. So there's a really important question that you can ask yourself. So right now, the way that we have this is we've got our baseline case properties. And then once you fill out the midline, those, as we've saved it right now, those would overwrite. Maybe that's okay. Maybe you're fine using form exports to look at the longitudinal. So looking at the baseline, looking at the midline and the end line, you'll use form exports. And then you want the case exports to always show you the most recent value. That's certainly something that is fine to do. Now, another thing that you can do, however, is if you want, you can actually rename these. Again, consent, date of birth, those are not baseline questions, those are registration questions. But starting at school programs, you can actually just write baseline at the beginning of all of these case properties. And then what we would do too is in the midline, we would append midline to the front of all of those as well. And what that's going to allow you to do is it's going to allow you to put baseline and midline indicators in the same case export. So a lot of people find this really really helpful to be able to grab their baseline, midline, and endline data all in one export, and that would be in a case export. The one thing that I will caution you with is obviously if you save the baseline indicators and the midline indicators all as separate case properties, you will have, double the amount of case properties, triple if you add an endline in as well. And so we do know that high numbers of case properties can lead to performance issues. So this is a relatively short survey. I feel pretty fine about adding in, triple the amount of case properties, but most baseline surveys that I see are quite long. And so if you do have a very long survey, you might not want to actually name them like this because it might have performance implications if you are saving too many of these case properties. So that's just something for you to keep in mind. Remember that you can always, when you're doing this app building, save all these case properties separately, go through, do some application testing, do some load testing, and see if this affects the usability, the kind of performance of the application. So right now you can tell I've got all of these baseline and endline properties. And the very last thing I want to show you is how you could calculate a baseline to midline change. So if we come into the form itself, you can see in the baseline and the midline, we ask them to rate themselves on a scale of 1 to 10 around 3 things. This is under the self-assessment. We say, how ready are you to enter the workforce? How employable do you think companies see you? And how important is it to you that you have a job? And we make them, again, write that on a scale of 1 to 10. So we ask that in the baseline, we ask that in the midline. And then one thing that, we know that projects often want to see is what is the difference? What's that delta between baseline and endline, or baseline and midline, or midline and endline, or baseline to endline? So here I'm going to write B2M workforce readiness. And then I'm going to do B to M employability. And then lastly, I'm going to do baseline B to M job importance. And what I'm going to do in all of these hidden values is I am just going to pull in that case property that tells me the baseline value, and I'm going to compare it to the midline. So the way that we do this is actually pretty simple. I'm going to pull over my midline, and I'm going to subtract it from my baseline case property. And actually, I'm going to need to refresh because I don't believe that we told it all of these. One thing that you can see here is I copied over this form and I forgot to tell CommCare that this is actually a follow-up form, not a registration form. So that is going to change the way that it shows me my case properties. You'll catch yourself as you go through and start doing this in your app building, because if you run into something like that, you guys saw that I didn't have that app properties box. You'll realize pretty quickly if you're doing something wrong like that. So let me come back to my calculation. And like I said, I want it to be midline. So that's that workforce readiness minus, and now I want to do this baseline workforce readiness. And now what this is going to do is it's going to spit out a number. Hopefully, if our project is working, I'm going to get a positive number. So maybe I thought I was, I rated myself a 2 on workforce readiness at the baseline, and now I've rated myself a 5. So if that's true, this is going to show me 2, that I had a 2-point increase. And similarly up here, we're going to do the same thing. We're going to take over that employability from the midline, and we're going to subtract the case property from the baseline. And then lastly, for job importance, very same thing. Take over the job importance midline and subtract the baseline. So that was a relatively easy thing to do within the application. And this is going to save you a lot of time when you actually pull your data out of the system and you're trying to calculate those baseline to end lines. You certainly could calculate something like that in Excel or in Power BI or Tableau. I tend to have a high preference for wanting to save things like this within the application, but it's totally your call where you feel that this is going to be easiest for you to do this transformation. So the last thing I'm just going to do is save all of these as case properties so that I have these in my case exports as well. So again, that's an example of how you can add in that midline. That was fairly easy for me to do. I copied over the form. I decided that I wanted to name my case properties separately from the baseline and the midline. And then I did some calculations to figure out the difference between baseline and midline scores. So I'm going to take us back in here, and we have a few more examples we want to go through. So that was adding a midline survey. Now this next one is adding in COVID monitoring. And this is something that we have seen a lot from a lot of you guys. A lot of projects that are working in the health field are either adding in screening forms for their frontline workers. So the frontline worker has to fill it out about themselves before they begin their work. Or if we're already collecting information about a mother, a child, a person, a farmer, a household, we will also ask them about any COVID symptoms and try to get them the appropriate help and ask them to quarantine if that's appropriate at the time. So again, our example here is your project is adding a COVID-19 screening form for all households. You need to build out the COVID-19 monitoring form that asks households about their symptoms and exposure. And so if we go back into CommCare, I have this household application. You can see here that I have a registration form, the monthly visit form, a first follow-up if someone reported illness, and a second follow-up if someone reported illness. That is normal illness. That is not directly related to COVID-19. This is my application independent of any COVID-19 things. And then additionally, this is the COVID screening form where I want to copy over my questions from. I did build this out separately last night just so that I wasn't going to take up a whole lot of time with you guys today, but we'll take a quick peek at this survey and then we'll look at how we would integrate it into the existing application. So in here, you can see that the questions come up are asking if anyone has symptoms, any of these COVID-19 symptoms. Has anyone been in close contact with someone who's a confirmed case? Has anyone traveled outside of the city? If so, where did they travel? And then what sort of PPE or preventative hygiene materials do they have? So do they have soap, hand sanitizer, cleaning products, gloves, masks, anything like that? And then at the end, based on the answers to this, if you said yes to any of these, we are going to refer you, we're going to consider you a contact. So there are really two things that I think would be reasonable to do here. We could either decide that we want to integrate this into our existing monthly visit form. I think that would make a lot of sense. For the mobile workers, it would be very simple. They would still open up the same form. They would just have additional questions at the end. Or you could, of course, make this its own form. So you can choose what makes the most sense for you. Both of them are totally fine options, but I'm going to choose to actually add this in the household form as well. And so we have here, I'm going to look, I have this next follow-up date, and I actually want to ask my COVID questions before that. So what I'm going to do is that I'm going to add in a group, and I'm going to call this the COVID screening questions. And I'm adding in this group so that I can nest everything underneath it. And whenever I need to stop asking those COVID questions, I can easily just hide this out. And then what I'm going to do here is I'm going to click on this, and then I'm just going to press Shift and select all of these questions. And then just by using these keyboard shortcuts, I'm going to copy them and paste them into this question group. And you can see now all of my COVID screening questions are right there. And that's all we do. So you can see that was relatively painless. Again, it helped because I had built out a little bit of my survey, but you could have easily added in these 5 questions to your existing form. Again, this is somewhat simple because we're actually just adding information about an existing case. We're already collecting household information, and we are just adding to that household information. So again, if we want to come here to this monthly visit, if we wanted to save these COVID questions as case properties, we certainly could. And actually, again, this needs to be a follow-up form. But we can just come here to symptoms and find all of the questions that we just added and save them in. I'm not going to save all of them just for time purposes, but that's how you would add in a monthly visit like that. Again, like I said, you could of course add it in as a new form itself, but I think the consideration I'm really taking into account right now is that I think it's going to be confusing for my mobile workers to have to add a new form to every visit. I think it's going to be hard to make them remember that after they do the monthly visit form, they need to go and fill out another form. So I think it's safest for my workers to just add these questions into the existing form. And now lastly, we do have one more example for you guys today. And this is tracking land plots. So we have a farmer application that currently tracks farmers' income, their practices, and their attendance at different farmer trainings. And now we want to start tracking farmers' land plots over time. So things like what are the crop yields, what kind of seeds did they use, what sort of fertilizer did they use, what sort of farming methods did they use. And so we want to look at each land plot on its own, not just at the farmers overall, because we're trying to identify if there are any geographic or different sort of factors that are contributing to some land plots being more or less productive. And so right now in this application, we are only tracking farmers. And so if I come in here to my application, you'll see that we have a farmer registration and then a farmer follow-up form. So we register farmers and then we visit them regularly to follow up with them. But like I said, what I want to do is I want to start tracking their plots regularly as well. So not just what was your crop yield as a farmer from all of your land plots, but we want to say you have 5 acres here and 2 acres here and 1 acre there. And let's look at those separately. Figure out if you're using the same practices, figure out if maybe different plots require different sort of treatment, and look at that on a more granular level. So obviously if we're adding in a new case type, we're going to need to add in 2 things. One, we need to somewhere to register these land plots, so register the child case. And 2, we also then need to build out the form where we're asking about fertilizer, seed usage, and overall crop yields. And so I actually want to build out the registration form, and then I'm going to build out 2 forms. One is a pre-planting season form, and the other is a post-harvest form. So we're looking before you plant, and then at the very end of the season, once you've had all of your harvest. So the first thing I need to do is add in the land plot registration. We want these land plots to be linked to existing farmers. And so to do that, I'm actually going to add a form in this farmer group module. So even though the case type is farmer, that's okay, because what we're going to do is we're going to add a form that's a follow-up form for the farmer. So that means they're going to have to select a farmer first from their case list, and then we're going to register child cases from this form. We're going to say register a new land plot. And the first question we'll ask is how many plots of land? And then we're going to build a repeat group that asks this. Now, in general, repeat groups are tricky. They work really well for registration and things like this, but sometimes I will dissuade people from using them. In a case like this, I feel pretty okay about it. And of course, we know that farmers will probably have more than one land plot. So I'm just going to add a few things here. I'm going to write location of plot, write size of plot in hectares. And then what else will we write? And then I'm going to write ownership. So see if it is farmer owned or farmer leased or cooperative. So these are the things now that are going to save with about all of my new plots. And of course, in order to register these, I do need to come in and set up the case management. So I'm going to come to this form, and I want to add in a child case, which I believe I need to add an add-on to make sure that I can use child cases. Yep. So if you guys ever go in and you try to create a child case and you can't, it's because you need to go to your app settings and add-ons. And then if I'm in here and I try to create a child case, I'll click on that and I'll show you we are going to be in a little bit of a predicament. You can see here, it asks what case list you want to create, what case type this should be. And we don't actually have a farmer or a land plot case yet. So what we need to do is we actually need to create a new module. And this is going to be where we put our 2 follow-up forms for the land plots. But we need to kind of establish this case type. We need to build this architecture out so that CommCare understands that we do have this new case type. So this first one we're going to call the pre-planting form. And here I'm just going to add in 1 or 2 questions. You would obviously probably want to make that a multiple choice question, not a text one, but I'm just doing this quickly. And then here, we need to make sure that this is going to be a follow-up form. And then similarly, here, I'm just going to change this. This is already a follow-up form, but this is going to be our post-harvest form. And I won't build out the questions in that either. I just really want to show you guys how this case structure happens. So then I need to come here and I need to call this my land plot module, and I need to change the case type. It's probably going to have defaulted to farmer, but we want this to be plot. And then up here, let's call it land plot. So now that we've established this new case type, this plot case type, now we can come up here and we can set up our child cases. So here we're just going to save as the name. I mean, plots of lands normally don't have names, so we're going to save the location as its name, and then we'll save the size and the ownership. And now this is going to create one case for every single one of the land plots that I entered here in that repeat group. And of course, once I have those land plots registered, then I can come down here, I can do the pre-planting and the harvest forms for them. It is really important that we register the land plots here in the farmer group and register them as child cases, because that's what established that linkage between existing farmers and the new land plots. If we just had a register new land plot form on its own, we wouldn't have established any of those linkages, and it was very important to us to track which farmers are farming on which land plots. So that's just an example, and there's so much more we could go over with those parent and child cases, and interesting case management we could do, but that's just a really quick review of kind of how you would set up that case management. So very lastly, I just want to go through a couple of app best practices, and then I'll try to leave at least 5 minutes at the end for questions. So best practice 1 is planning. From day 1, plan for all potential aspects of your application. And so this is really talking about the very first time you even sit down to plan and design any part of your app. Think about all the things that might come up in the future and make sure that the design that you have can accommodate that. Next, focus on design. So again, take time to think about how this new functionality fits into the existing app design and case structure. So anyone can easily build out a new form in an application, and that's not hard, but where you get stuck is on the UI or on the case management or on the data export side. So you really need to think through, if I throw this new form or these new questions in, how is it going to fit into everything that I have right now? And what does that look like both from a mobile perspective and a data perspective? Of course, you also need to think about how this is going to fit into your existing on-the-ground workflows and how your users' day and their work will change. So like I said, maybe if you're really increasing the amount of work they have to do, maybe you need to lower their targets in other area of work. If they're having to go to new places or talk with new beneficiaries, again, that's going to be a whole new task for them. They might need training, they might need a lot of support in the beginning. So think about the sort of support and the way that you're going to kind of roll out this new workflow and make sure that you're setting up your users for success. Do not rename properties. If I could tell one thing about app changes ever, it would be to not rename properties. Don't rename a question ID. Do not rename a case property. Anytime that you rename a question ID in your form export, it's going to create 2 properties, and you're going to have 2 columns now. So even if you made a typo in one of your question IDs, keep that question ID. You can always change the label text, the display text in the export, but do not change the actual question ID. Similarly, with a case property, if I had something called name and then I switched it to full name, that's going to create 2 columns in my case export, and it's going to kind of bifurcate my data. So just do not rename properties in the application. You have the option in your exports to change whatever comes out as that column header. Use that option. Just change the display text on that export. Do not change the actual source data name. Test your exports. This is really good. I mean, most of this advice is really best practices for everything, not just when you're adding a new functionality, but especially when as your app building and your app testing. Create some form exports, create some case exports, download them, make sure that the data looks like what you expect. Download some of the data and look at what it looks like when you have cases and forms from earlier that don't have this new data, and then you have cases and forms that do have this new data. So this will prepare you for what to expect when you have real data coming in that has some of these new properties and your old data does not have those properties. It'll just prepare you for what these things will look like. And of course, if anything looks totally crazy when you take these exports, you have the ability to go back to change choice values, change question IDs, change case property names. You can do all of that before you've launched. And that's what we would encourage you to do if things are not looking right. And lastly, communicate. Be sure that you're communicating with all your users about changes that you're making. So make sure that they know what's coming up in the pipeline. Make sure they know the exact date that they need to update their application. And of course, if it's a big change, retrain them. So, do a refresher training, do, a phone call, give them some training materials, do something in person, but make sure that whatever new functionality you've added, they understand what it is and they understand how to answer those new questions, how to conduct that interview. If it's going to be an interview with a new type of person, you're really going to need to do a lot of training with them to understand how to interact with that new person. And of course, as always, if you guys need help with your application, if you're trying to add something in, the customer success team does sell capacity building packages. And so we have these 3 different ones. We'd encourage you to get in touch with us or get in touch with our sales team, and we're happy to talk with you more about that. And so with that, Avni, I think let's switch over. We have 6 minutes. All right, I have 1 more minute than I promised to do some quick questions.
Thanks, Erin. Thanks for walking us through that. I definitely found a lot of use in some of the slides that you mentioned because I've made these mistakes while building applications. So thank you for walking us through that. We have just a couple of questions. Justin wants to know if there's an easy way to connect uploaded cases with a form. I'm guessing it's a new form with an older case, but Justin, if you have a follow-up question, feel free to type it in. But yeah. That's the first.
Yeah, that's a great question. And I will say too, I've made all of these mistakes too. So these are lessons learned over 6.5 very long years of making mistakes in CommCare. But yeah, so if you're deciding to upload cases, really an uploaded case, if you're uploading the same properties that exist in your registration form, should act like any other case in your application. So what I would say is look at your registration form, look at all the case properties you've saved there, make sure all of those are in your import. And then once you import that, those cases should be able to interact with any form as long as it's of the same case type. So if you're adding in a COVID screening form for households, obviously you need to import household cases to make sure they have access to that form.
All right, great. Thanks for that. Our next question is from Stephen, and this is a question I had for you as well. When you dissuade people from using repeat groups, what is your recommended favorite workaround? And also generally, what are some issues that we see with repeat groups?
Yeah, and so this is a great question, and this would be, if I could give you guys one takeaway from this, it would be do not use repeat groups unless you must. And that I know how crazy that sounds. Repeat groups are cool, they're fancy, they're advanced, you really want to use them. There are a few reasons that I dissuade people from using them. One, any data that comes in a repeat group is in your export is going to come in a separate tab. So a lot of people get really frustrated that like half of their data is in one tab and half is in another tab in their export, and it's because the repeat group comes out in a new tab, so it can make data exports really frustrating. And secondly, it's just enormously difficult to reference questions within a repeat group with others. So you have to use this like current / syntax. It's a complicated syntax, and if you can avoid using it, I would. My favorite, it's an inelegant workaround, but I think it will save you quite a bit of hassle, is just create a question group and copy it as many times as you think it might be needed. So if I'm registering household members and I know that there's never going to be more than 20 of them, I will truly make one question group with all the questions for a household member, and I will copy it 20 times. Now that looks horrific in Form Builder. It looks messy. It seems like there should be a more efficient way, but in terms of like the data, it's going to be so much easier for you to look at your data, and it's going to be so much easier for you to reference any questions that are within that question group. So that's what I tend to do. And this is something I do myself. This isn't just something I recommend to you guys. It's also something I do.
Right, thanks for that, Erin. Justin actually just posted a follow-up question. I want to just close the loop on that. He was asking for linking a new case with the form.
Yeah, so if you're, there's no way that you have to link cases, right? As long as you're of the same case type, you should be able to use any form. So if you're importing new cases, again, just make sure that all the fields that are in your registration form, all those case properties are included in your data import. Once you import those new cases, assuming that the new form is of that same case type, you should be able to look at those new cases.
All right, Lance's question is a little similar. Do I need to import cases when developing an app that references the same case type?
If you want those cases to already be there, yes. We did this with a partner in Kenya. They created this whole COVID toolkit, and they already had, I think, thousands of household cases that they had collected data for. And so she and I talked about, do you want to just start this COVID app completely new? And you'll, like, the downside of that is you're going to have to re-register all of the cases, like all of the household cases. So in the new app or in the new functionality, you would have to actually like register everyone again. Maybe that's really simple for you, and maybe that's preferred over doing a whole big case import. But I would say in general, if I have thousands of cases already registered in one app and I'm starting a new one, I would certainly like to not make my users re-register those people. So I would do a big case import. Also,
Right.
one thing in the same project space, even if you have two different applications, but they use the same case type, the same mobile worker will be able to access both of those cases in the different apps. So if I'm a mobile worker and I have all these households in like my household health app, and then I also have this COVID app toolkit, and both case types are household, whether I log into either app, I'm going to see the same cases. So if you want those to be different, you need to make a different case type in that new app. And you can import those cases under a different case type, but just something to be aware of, that cases and case types are universal throughout a project space.
All right, great. Thanks for that, Erin. And our last question right on the dot. Have we ever faced issues with copying and pasting questions with the Control-C, Control-V command? Is there any other workaround, or should Control-C, Control-V work usually?
Control-C, Control-V, or if you're on a Mac, it'll be like Open Apple C, Open Apple V, should always work. It can be a little bit pesky. Like, you definitely need to have already clicked on a question in CommCare to start doing Control-C. So you need to have clicked on that in Form Builder, but that's definitely the easiest way to copy individual questions. You can, of course, copy a whole form. If your form, like how we did the baseline midline, if your form is going to be really like pretty much the whole like same form, maybe just minus a few questions, then I'll always copy the whole form. Otherwise, I think it's pretty easy to copy and paste between forms. I just like to have them in two tabs side by side so that I can click from one into the other.
All right, that makes sense. And you can do that for multiple questions as well, and not just the one question. So you can Control-C on multiple questions and then paste it. All right, great. I hope that answers your question. And that brings us to the end of our webinar. Thank you so much, everyone, for joining, and Erin for walking us through that. As I mentioned earlier, we will be sending a recording latest by tomorrow. In case you have any questions, feel free to respond to that email, and someone from the team will reach out. And thank you again for taking out the time, and we will be in touch for the next one.
Thanks, everyone.
Bye-bye.
Bye.